The Ministry of Health is yet again on the spot with revelations that the country lost 11 billion Kenya shillings in half a year in yet another scandal. Even after the installation of what was termed as tight procedures and waterproof IT system to secure the hard-earned deductions from Kenyan employees, the billions were still siphoned through fictitious surgeries and fraudulent claims by health facilities in the country, with the help of social health authority workers. Appearing before the National Assembly lawmakers in Nakuru County, Health CS Aden Duale disclosed a new trend where expectant women were forced to undergo surgeries during childbirth, some of which were unnecessary, to inflate the claims. As our political affairs reporter Emmanuel Toh now tells us in the following report, 50 medics have been struck off from the list of those with Social Health Authority authorization rights as part of the crackdown, which now begins according to the ministry.
His presentation before the National Assembly retreat in Naivasha, Nakuru County laid bare how the taxpayer lost 11 billion shillings in just 6 months from October 2024 to April 2025. Health Cabinet Secretary Aden Duale lifting the lead on how many privately owned health facilities forced mothers to the theatre for delivery.
Because C-section is complicated first. It's a surgery, it's a theatre. It's 30,000 reimbursement. But normal delivery is 10. And because of greed, it's a social problem. Somebody wants to force a mother to a C-section when she can do normal delivery. But because he's looking at the difference of the 20,000.
Even so, Duale revealed that many of the forced C-section surgeries were fake.
We found one facility in a county where they told us level 3, they said they are doing C-section. So I walked into that facility and I asked, the governor said that facility cannot do C-section because there's no theater.
Lakini siku hizi hakuna wa kusema sukuma, wanasema tu peleka theater, pasua toa mtoto. We want to go back to Sukuma.
CS Duale enumerating other cases of fraudulent documentation, mostly filled by one individual, which were used to siphon the billions from SHA coffers.
We have one patient whose dependent children were 381 in Duale County. And we are giving such patients, we are giving them to the DCI.
Members of the National Assembly pushing the CS to reveal the details of the individuals who were caught in the scandal and the measures taken so far.
Why haven't we seen a single person take plea in the court of law for fraud or for corruption?
2 of the former CEO of SHA are before court. 25 doctors, SHA has withdrawn their rights to access.
CS Duale saying he presented over 1,000 files to the DCI for investigation in September last year, but the pace of settling the cases is yet to hit 100%.
And one of the most best counties, Muranga County.
Despite the gloomy picture, the ministry still presented a case of a fairly successful SHA rollout, revealing that more than 29 million Kenyans had already registered to the platform. As the government ramps up the implementation of the Social Health Authority, the ghosts that undermined the National Health Insurance Fund seem to have come back alive, even as the Ministry of Health now promises to go after all the cartels who were involved in the fresh 11 billion shillings scandal. Emmanuel Toh, Citizen TV, Naivasha constituency, Nakuru County.
The whole concept of the universal, the Taifa care, was to make sure that we break these rich hospitals for the rich and hospital for the poor. Today, a Kenyan can walk to Aga Khan, to Nairobi Hospital, to Kenyatta Hospital, level 6, access dialysis, paid by SHA for both the 2 sessions. I can see you're busy with your phone.
Yeah, because I'm getting so many messages here.
Right.
So many messages. People are not happy. Like Stephen Zhao is saying, I got deducted 800 shillings and SHA doesn't pay for me anything anywhere. They even don't have an option of choosing the hospital. Bure kabisa.
No. What is 800? There's nothing called 800. Either you are formal, 2.7% of your income, or you go through the SHA lipa pole pole. There is no 800.
Okay, but he says he went to Kenyatta last week on Thursday, and he spent 21,000 shillings, and SHA didn't even pay a cent.
He is not a member.
What do you mean?
He's talking of 800. Which rate is he talking about? Is he in Kenya? Maybe he's in South Sudan. Listen,
yeah.
You work for Royal Media.
I get deducted.
2.7% of your income.
Yeah, 2.75.
That is not 800. If you are in the informal sector, Mama Mboga, Kenyans border, they go through the mean testing. They go through the lipa SHA pole pole. They pay 4 months. Then they balance. They can pay slowly. So 4 months cannot be 800.
Maybe he's in the informal sector, and by the way...
No, it's not 800 then.
Huh?
It can't be 800.
Okay, how are you going to target the informal sector?
That's why I'm telling you. SHA lipa pole pole, which was launched by the president in June of last year during the Madaraka Day in Homa Bay.
Yeah.
As of today, this evening, 420,000 Kenyans have enrolled into that, paid 1.4 billion shillings, and they're accessing specialized treatment.
John Geshui.
This was not there before.
John Geshui Mboro says there's no cancer treatment drugs in Kenyatta National Hospital. Yet in private hospitals, cancer patients are suffering. What's happening?
Number one, cancer is a very serious disease. And I'm focusing on cancer, maternal mortality, and child death mortality rates. Yeah. But cancer, every year we estimate about 44,000 Kenyans.
Dying?
No, 29,000 die. Okay? And not only us, it's a global figure. In fact, it's raising up. And that's why the president, in his wisdom, at the State of the Nation address, he increased the SHA package, reimbursement package, for cancer patients from 550 to 800. At 550, it was above the former NHIF. But when we studied and we felt they need more sessions, we took it to 800. Let me give you the good news. Roche, Roche is one of the major world pharma companies.
I know.
There's a drug that they make for breast cancer called Herceptin. It was, when I was coming to office, it was at 120,000 per drug, per session. We signed an MOU. Today, it's being sold at 40.
40 what?
40,000. And paid for by SHA. When I came in today, you can walk into Aga Khan, you can walk to Nairobi Hospital, you can walk to Kenyatta Hospital, do a kidney transplant, as long as you come with a donor. Both pre, post, and during the transplant, at the cost of 1.2 million shilling, fully covered.
By SHA?
Yes.
Okay. Speaking of SHA.
The WhatsApp group for raising funds in Kenya has reduced by about 51%. And by 2027, when we are going to the elections, where William Ruto will win. William Ruto will win by 2 million to 3 million votes. What he said is true.
Just because he said...
I have told you...
He said that yesterday.
No. I have with you in the bench. What I have told you happened. I told you William Ruto will win. You didn't believe it. He won. He's going to win by 2 to 3 million. The rest are jokers. The serious competitor is not around.
He might emerge.
No. Nobody.
Huh?
Raila Odinga's political constituency and stature was like a pillar. You have been to New York. Time Towers.
Time Towers.
So it has crashed. To rebuild it, it will take time. No leader had a solid, radicalized, strong constituency. All these other opposition players, they cannot fill Uhuru Park. Tell them to fill, I'll pay. I'll pay for the money. It's only William Ruto can fill Uhuru Park.